Everyone. Senator Leo Housakis is tweeting, quote, "How is prison not the safest place to be? Our seniors aren't being moved out of long-term care for their safety. We're being told to stay inside our homes. Wouldn't releasing prisoners go against that reasoning? This is beyond the pale. Our government is doing whatever it wants to do." And this is tweeted on 22 hours ago. And originally, this was tweeted April 21st. "Hundreds of federal prisoners paroled as pandemic relief measures," says Bill Blair. And we're going to look at this because, well, our tax dollars at work. We fund the prison system, right? We put money into the buildings. We put money into staffing it. We put money into keeping prisoners healthy. We have prisoners in bunk beds, right? Like 2 people per cell or whatever. But isn't that the same as kind of living with somebody, like in a hotel room or in a cruise ship or something like that? So it's interesting that the move is to just release people. Now, an argument could be made, but an argument could also be made that you could just change the way things are done at the prison to limit the potential for infectious spread, right? Instead of just releasing people wholesale. Now, are there a cohort of prisoners, people who are serving weekend sentences or something to that effect, that it might make sense for? I guess so. Sure, you could make an argument for that, I think. But by and large, there are people, and I'll show you some examples, who are asking to be released who definitely shouldn't be, but who are being released, right? Here's a gentleman here. It says, "Man awaiting first-degree murder trial seeks bail, citing COVID-19 outbreak." I don't want to die, man. Somebody's already dead. You people have blood on your hands if you send me to prison. Don't worry about the blood on my hands, you know. So weird. Anyway, here's Guelph. And it says, "Drop-in center closes for now as services continue in other forms." I think what they're doing is funneling people out of prisons and into hotel rooms on our dime. Double, right? We're paying for the prisons, we're paying for the staffing, and now we get to pay for the hotels and the meals and all that other fun stuff too. And there's donations that come into it. But this seems really strange to me. Okay, Guelph Today reporting, "Drop-in center closes for now. Services continue in other forms." The Guelph Drop-in Center has had to adapt to how it provides its range of services. On the weekend, the center closed its doors of its Gordon Street location because there just wasn't much demand right now for the physical space that is normally the hub of activity during non-COVID-19 times. Many of the drop-ins' regular clients are now being sheltered in rooms at 2 city hotels away from the downtown core. Quote, "The work is still happening, we're just doing it in a more efficient way. Drop-in center staff and volunteers are providing support at a number of other locations and programs it has teamed up with other organizations to offer, including the 2 hotels being used as shelters, a new supported isolation room location, and daily food program. A lot of our homeless population is in hotels as of Monday. We're at 75. That takes a lot of staff to support the people in the hotels. 3 city shelters have been closed, creating the need for the hotel rooms. We have more rooms for people than we've ever had in the shelter program," Hoekstra said. "Meals are still being distributed twice daily at 11 a.m. and 6 p.m. at the front door of Royal City Mission on Quebec Street, a joint effort with Mission and others. Meals are also being delivered to those sheltered in hotels." Okay. Doesn't this pose exactly the same potential pitfalls as prisons and other like long-term care facilities, etc.? Are we just moving them from one expensive solution, potentially exposing them to another solution, potentially exposing them in exactly the same way? Cruise ships, long-term care facilities, hotels. This is Airborne, and we've talked about this before. I've talked about this many times. This is Airborne, and sharing the same. I mean, even people in a condominium or apartment are potentially being exposed in the same manner. So, are we releasing prisoners just because of that? Are we not adopting and changing the routines in our prisons to deal with the fact that there's contagious disease rampant? Or what are we going to do with people like this guy, right? Not that guy. Whoops. This guy. What are we going to do with him, right? I mean, does he have a point? Can't go to a long-term care facility or a hotel either, but, you know, no, I think that this is folly. I think this is not good reasoning. Here's CBC reporting, and this is April 22nd. Today is the 23rd. Prison watchdog in the dark on inmate early release plan to limit spread of COVID-19. Canada's prison watchdog says he's been unable to get information on how many federal prisoners have been released early to limit the transmission of COVID-19, as warnings about a potential rise in cases behind bars grows louder. Despite repeated requests for numbers from Correctional Services Canada, correctional investigator Ivan Zinger told CBC News he's gleaned only anecdotal information about 2 pregnant women and another inmate with cancer who have been released due to the pandemic. So far, I've not received any data showing how many above the normal in and out are coming out, he said. Scroll down a little bit. Late Tuesday evening, CSC responded to a set of questions from CBC, but did not say how many prisoners have been released early due to COVID-19. It only said that on average there are 600 offenders released each month, and in March there were 636 released from custody. So, I mean, there's more to this. Link is in the description if you want to check it out. Here's a little bit more from Bill Blair. This is from March 31st. Bill Blair asks prison parole heads to consider releasing some inmates to stop spread of COVID-19. I'm just reading the important parts because I've got a lot of tabs to get to here. Quote, Minister Blair has asked both the Commissioner of the Correctional Services of Canada and the Chair of the Parole Board of Canada to determine whether there are measures that could be taken to facilitate early release for certain offenders. And it's funny, they use a little bit of a bait and switch, and I'll show it to you right after I talk about this. I scroll down. Prisons, like nursing homes and long-term care facilities, are considered high-risk environments. They are typically crowded, stressful environments with disproportionately high levels of chronic disease, often because of larger number of offenders with past drug or alcohol addictions and histories of poor nutrition. Doesn't that also describe the homeless population? Oh, here it is, Global News, 2016, addiction a top cause of homelessness across Canada, but not always number one. Okay, so isn't that strange? We're taking a high-risk population and moving them into proximity to another high-risk population in hotels for double the tax money. Your tax dollars at work. Aren't you happy? Here's CTV News. I covered this back when it happened on April 4th. Ontario releases more than 1,900 inmates, many with nowhere to go. Maybe I should send this clip to our handy Mr. Zinger here, eh? Like, if he can't get the numbers, I mean, he just needs to look at the newspaper, right? This is from April 4th. Anyway, Ontario releases more than 1,900 inmates, many with nowhere to go. Nowhere to go. The province of Ontario has been releasing hundreds of inmates as of late over public safety concerns due to COVID-19, but some say that these men and women are being left with nowhere to go. John was recently let out of Sudbury jail after serving a sentence for assault. He's also had a difficult time struggling with his addictions. Quote, I was in the Sudbury jail for about a month, and they released me on conditional sentence. 12 months, he said, John. It was due to COVID-19, they said. It was a light sentence due to my previous history. He's asked that we not use his name or identify him. According to John, there wasn't much in the way of physical distancing until he was released. He had lived with a cell partner, and there was up to 16 people who lived on the range. It was nerve-wracking thinking about it because you never know. The difficult part of his release was finding out there wasn't much in the way of available help on the outside, particularly when it came to his rehabilitation. There's no support, everything's shut down, even social assistance. It's hard to get in there, right? So John says he still has nowhere to go. Quote, they need to offer the inmates more to the inmates here because they kick you out on the street. They have nowhere to go. They expect you to follow the rules and whatnot, but they make it hard. Okay, so this is in Ontario. The other one was talking federal prisons, and I just want to make that clear. I was making a joke, but I want to make it clear there's a difference. And this gentleman poses a good question. Is the right answer providing hotel rooms, or is the right answer providing a longer stay in the prison if necessary until they have a plan, or is it making essential the services, aftercare for people who have been recently released from prison, etc.? There's clearly problems that clearly need a solution, but is the right solution taking people from one crowded situation full of inmates and full of addicted people and full of potentially chronically ill people and putting them into another one? Right? Is a prison meaningfully different than a hotel? Is it meaningfully different than a long-term care facility? How? In what way? Why? We're not moving our elderly out of those. We're not sending them back to potentially family members, etc., who are ill-equipped to deal with them. Why are we doing that to prisoners? Does that make sense? It doesn't to me. So maybe I'm wrong. Maybe John has a really good point, and providing hotels is a necessary step that our community should be doing, and taxpayer money be darned. It doesn't matter how much your property taxes will increase. It doesn't matter how much we have to pay. We should do this. But at the same time, should we then be funding prisons, or should it just be all hotels? Welcome to court, sir. I'm sorry, you're sentenced to 12 months at the Holiday Inn. And no pool access. Don't let him be in the hot tub, okay? Did we have an armband for that? No? Oh, we can't do that? Oh, okay. Never mind the armband thing. Right? Like, it just seems crazy. And it doesn't seem like this is well thought out at all. It seems like a very expensive fix for... That's not a fix at all. It seems like something that somebody playing chess who doesn't know how to play chess has opened with moving their queen out. And you're like, dude, really? So maybe that's a bad analogy, but still. Here's an article that shows that COVID-19 is airborne. And weird, right? Weird. What are we going to do with you? Put you in jail? No pool access, sir. Anyway, moving on. Here's another one that is just odd, right? This whole Nova Scotia thing. I'm going to do this one in a bit of headlines. RCMP has fairly good idea guns used in Nova Scotia mass shooting acquired illegally. Police say the man who went on a murderous rampage, positioning everyone, through 5 Nova Scotia communities was likely using unlicensed firearms. Okay. So I don't understand why it can't be ironclad. Either he was not legally allowed to have firearms, or he had illegal handguns, or he had illegal firearms. But this likely, like, it's very soft language. What is that? Why are you saying likely? And then writing the article as if you had given us an ironclad clear discernment of whether it was illegal or not, right? They come out and they do say that he was not legally allowed to have the guns, I think, but still, the muddy language persists. It's very strange. Here's another weird part of this. Evacuation center peppered with bullets morning of Nova Scotia mass shooting. So we've got one RCMP officer impersonating one man impersonating an RCMP officer driving around in a really convincing looking car with the CB radio antennas and a full uniform and presumably a sidearm, but at least a rifle, right? Or something to that effect, something to shoot people with. And then this happens, okay? Same morning. Nova Scotia's police watchdog is investigating why 2 uniformed officers were shooting in the direction of a fire hall in Onslow being used as a place of refuge the morning of the shooting rampage. Again, right? The rampage. It's a rampage. At this point, we don't see what they were shooting at, Curran said. We do know the shooter was not in that area at the time. So these guys got out of the car and they started shooting at the fire hall. Back to this. In a Facebook post Wednesday morning, the Onslow Belmont Fire Brigade confirmed its building sustained, quote, considerable damage as a result of the situation. And there's pictures of the bullet holes in the building. It also took one of the fire station's trucks out of service. The hall was used to provide a place where residents could come and take a break, register, and get hotel and Red Cross information, the fire brigade said in the post. The brigade said there was an RCMP officer and cruiser staged on its property to assist with evacuation registration. They said multiple people were at the fire hall when the shots rang out. Our video surveillance does not capture the shooters, but does show 2 people resembling RCMP officers enter our property, one to the front and one to the rear, the Facebook post said. One of these people enters our hall at the front, but no one sheltered inside the hall spoke with the police, with people, the person resembling the RCMP officer, so we cannot confirm why they were there. The statement, which has since been deleted, added that no one identified themselves as an RCMP officer. They left our property shortly after the gunfire. The post concluded, we have since been contacted by SIRT and are cooperating with their ongoing investigation. Fortunately, no one was physically injured. The Onslow Belmont Fire Brigade said it deleted the post because it never intended to instigate conspiracy theories or confirm anything about a shooter at large. Hold on a second. The morning of the largest mass shooting in Canada by the man that I was talking about with the fake car and the fake uniform, and you don't want to instigate more conspiracy theories because 2 other uniformed RCMP officers shot up a shelter-in-place building while people were inside? That's insane. That's insane. Like, you know that you've gone way too far in political correctness when you're saying, listen, I don't want to be a bother or anything, and I don't want to contribute to those crazy right-wingers, but these RCMP officers were shooting at seemingly nothing and shot up the building and took a car out. So what's up with that? Like, if that's the RCMP acting, what's up with that? If that's 2 more rogue officers or 2 more people who, I guess, can just get an RCMP officer uniform on eBay and maybe a car at auction and, a CB radio on eBay, this is really concerning. And it's even more concerning that people are deleting posts because they don't want to be seen as a right-wing extremist when these are the facts. It's insane. It's crazy. Back to this. Quote, taking down our post does not diminish or erase the events on Sunday, and we know everyone is looking for answers. So we encourage people to refer to RCMP and or SIRT news releases and briefings to get factual updates. Yeah, those RCMP, man, they are beyond the pale. They are absolutely known to be, unless there's a guy pretending to be an RCMP officer, or I guess two real RCMP officers who never identified themselves and shot up a building. I'm maybe going to not trust the RCMP as much as I used to, hey? Like, sometimes behavior matters, right? Here's another one, headline. A mass shooting was happening. U.S. consulate in Nova Scotia sent email alerts to warn American citizens. We got a tweet. Canadians got a tweet. And nobody can explain why. And somebody said that Nova Scotia doesn't have an emergency alert system. They do. They have an Amber Alert system and an emergency alert system. And neither was used. In the emergency alert system, people came in of their own accord to be ready to send out an emergency alert because they figured it was coming. And no. Nobody asked them, so it was never put out. Here's the last story for this morning. This is concerning the second wave. This anchor is positioning the second wave as hitting the next flu season. The next flu season is like wintertime, and like we're 7 or 8 months away from this. So he's kind of positioning this as this is far away. The doctor starts talking about how, well, I'm just going to let it run for 30 seconds or so. And then I'm going to show you, because they're talking about a second wave now in nursing homes. So what is it? Is this second wave looming? Something to fear? The boogeyman in the closet? Or is it here now? Here we go.
A little bit of different messaging from the Prime Minister and public health officials, and then what we heard yesterday from the director of the CDC. The Prime Minister has said that this is, the first wave is the worst one. We've heard that from public health officials as well, and then it'll be followed by wavelets, second and third wavelets that'll be less severe. The director of the CDC coming out yesterday and saying actually he believes that the second wave will be worse than the first because it could coincide with flu season, and then you'll be trying to put out two fires. What are your thoughts on that?
Yeah, I mean, I think they both have really good points, and it's in all fairness, I honestly don't know. I think it's going to be very tough to know what the second wave is going to look like. And certainly I know that if we do practice physical distancing, if we do have some public health measures in place, we can reduce how large that second wave is of COVID-19. And in fact,
so I'll point out the first wave didn't have masks, had people landing daily, had all sorts of strikes against it, and we've flattened that curve now. And so they're threatening against this boogeyman, but at the same time, here's another one. Toronto's top doctor releases chart showing COVID-19 data. It suggests second wave is likely. Ooh, it's coming. And here is the last one. Community spread of COVID-19 is down in Waterloo region, so why can't we stop physically distancing? Here it is. The number of cases of COVID-19 from community transmission is down in Waterloo region, but acting medical officer of health, Dr. Su Li Wang, excuse me if I've got that wrong, says it's far too early to relax physical distancing measures. There's currently a second wave of the novel coronavirus in long-term care and retirement homes. The region is following, this is limited testing, this I thought was really weird. The region is following provincial guidelines on who should be tested, and the test is limited. The general public is not being tested even if they have symptoms. Those being tested include essential and healthcare workers, their families, hospital patients, and people living in long-term care and residential homes. The region does between 90 and 130 tests each day, according to numbers reported by the region of Waterloo Public Health. Last week, the testing was expanded in the region to all people living in long-term care and retirement homes, not just those showing symptoms, but actual number of tests done in each day didn't spike. So I just thought this was weird. The actual number of tests done each day didn't spike. Well, no. Like if this is the number of tests you're doing each day, and then you expand where you're doing them, but you don't change the number of tests, you're not going to have a big spike, right? Right? Like, to me, if they're trying to expand, that means taking the 130 number to say 500. And then you would expect a corresponding daily increase, right? If you're testing 500 people and a certain percentage have them, well, it's going to be higher than the same percentage of 130 people, right? So you get a spike. So Weird. And then it goes further. Wang says that's because community transmission has significantly slowed and fewer people in the general public meet the criteria for testing. So the whole thing just seems like they're talking about they're implying like they're talking about one thing when really they're talking about the other. And if you're talking about the one thing, this matters. But if you're talking about the other, it doesn't. Do you see? Maybe I'm being a little bit too cryptic there. I'm not sure. And I'm not trying to be cryptic. I'm just maybe not explaining it very well. So I apologize for that. But it just seems like the news is written for you to fill in the blanks, and it wants you to fill in the blanks with, the primed response, which is everything's fine, no problems. This is all part of the plan. Stay in your house. And how many months of emergency supplies and money do you have? Okay, just stay in your house and wash your hands. The boogeyman is coming. Weird, right? But we're moving people out of prisons and into hotels when they have nowhere to go, right? It's the weirdest non-response to a public health emergency. Wear masks and shut down the economy. This is the only way to fight this. Let the prisoners out, but stay in your homes. This is the only way to fight this. We couldn't possibly... Sorry, my computer just froze, so I'm going to still put this out. We couldn't possibly change our practices. We couldn't possibly do something else to fix the problems in our infrastructure, in our prisons. We have to let the prisoners out and then into hotel rooms. It's so strange. Thanks for watching, everybody. Check out canadapolitics.com. Sorry about that pause there. I don't know what happened, but my computer definitely paused. I'm glad my recording didn't stop, though, because that would have made me very upset. Thanks for watching. Check out canadapolitics.com, canadaReport.co, and have a wonderful, wonderful day.